My name is Krishna. I'm a professor of medicine at the Ohio State University Wexner Medical Center, and I'm also the director of advanced endoscopy at the center. Endoscopic ultrasound guided radiofrequency ablation, or otherwise EUS-RFA, is a novel ablative technology, and till recently we didn't have any ablative tools which could be used through EUS. And it has specific purposes and indications as of now. Since my focus is ablating pancreatic cystic lesions, that's where I'll be talking about, and that's what we will focus on as far as developing a program to ablate pancreatic cysts. The key step is accurately diagnosing pancreatic cysts so that we know as to what kind of cysts we are ablating. Many of these cysts do not need any treatment. Majority of them, they can be just watched, or what we call as surveillance, but a small proportion of them can progress to cancer. And while surgery is still the mainstay of therapy, in certain patients who are older or have other health issues, we can possibly do endoscopic ablation. But of now, at our center, I think we have probably ablated the highest number of pancreatic cysts. That's specifically IPMN, which is a type of a precancerous pancreatic cyst. To really start the program, we need to have excellent tools to diagnose, assess the risk, know who to ablate, who not to ablate, have a multidisciplinary board of specialists who can give an opinion, have a organized meeting, a weekly meeting where we discuss these cases and decide who needs surgery, who needs ablation compared to who would need surveillance. And with that, having the support from your endoscopy division and getting some experience with ablation, going and spending some time with other specialists who are ablating lesions elsewhere, and then starting with low risk lesions, and then gradually increasing complexity of lesions one would treat over time. But at the core though, one really needs to know what they're ablating as far as the diagnosis of the cyst, and so also the risk of that precancerous cyst. There are multiple success stories. In fact, Ohio State University did a news article which was on multiple news channels as well about a patient success story where they underwent ablation and they had complete resolution of the IPMN. So for these patients, once we offer ablation, when the cyst decreases more than 70, 80, 90%, more than 90% is what we call as complete response, because we use sophisticated computerized technology to measure the volumes, which picks up the smallest of volumes. So when they have response, multiple things. Of course, they know that the lesion is gone, and then the fact that they don't have to have MRI every 3 to 6 months, and we have basically come down to MRI once a year, and it's a different feeling for the patient. We had in the 30 precancerous cysts we have treated, in about 40% of them they had complete response. So pretty much every patient there has had a success story. And in the remaining 40%, although the cyst is not completely decreased in size, molecular markers which are diagnostic of this precancerous type, they have resolved. So that's also kind of a success story. So there are multiple success stories in terms of ablation. I've been working with Tewong for the last 2 years, and it's been an excellent collaborative effort between our institution and Tewong Medical, and they have been extremely supportive so far. And pretty much, in most of the issues we have had, they've always been there to help us in terms of support, not only on-site support, technical support, and such kind of collaborations with industry will be very helpful.